All right, so I guess we're ready to go. Welcome to Trib Talk, Salt Lake Tribune's format for discussing important issues. I'm Gordon Monson, I'm your host, and our guest today is Dr. Angela Dunn, who knows a thing or two about coronavirus. So, Dr. Dunn, welcome in.
Yeah, thanks for having me here. Good morning.
Morning. To begin this discussion, why don't I ask you, about a week and a half ago, 2 weeks ago, Angela, I had the opportunity to talk with you about your life, about your narrative. Can you give our viewers, our readers, a little bit of background with you? Many of them are familiar with you by now, but give us sort of the Cliff Notes version.
Sure. So I'm a physician by training. I went to medical school in Miami, Florida, and then Southern California for residency training. Followed that up with a fellowship with CDC, doing pandemic and epidemic response at the height of the Ebola epidemic, and then made my way to Utah.
A little bit of background with you. So, can you tell us a little bit about your experience in Africa? Because I thought that was a really interesting aspect to your background. For this reason, it seems as though that we're coming to appreciate physicians, healthcare workers, people who are putting themselves essentially in harm's way to help the community as a whole with this particular virus. I thought your story about going to Africa, there's an Ebola outbreak, and what do? You rush to Sierra Leone to help out there. Tell us a little bit about that experience.
Yeah, so I was working for the CDC at the time, and my role there was to be in a rural village and help them set up contact tracing, which now we're becoming all more familiar with what contact tracing is, and also help provide infection control guidance to ambulance drivers, first responders, burial teams, and the physicians there so they could protect themselves against Ebola as well.
Well, okay, so eventually it's a long and winding road, but you end up in Utah, and now you are the state epidemiologist, and then we have a coronavirus outbreak. Prior to that, you had been working on all kinds of other projects for public health in our state. The coronavirus thing happens. I think we're pretty well versed in what's been going on up to this point. How is Utah doing as far as COVID-19?
Yeah, so Utah is in a great spot, and a lot of that is because we have really high testing capacity and the ability to keep doing contact tracing for all of our positives. So a lot of my colleagues in other states, still can only test really high-risk people, so those in hospitals, and have limited contact tracing to incarcerated populations or specific outbreaks. So we're able to do all of that for everybody, and that's helped us plateau. So for the past 10 days or so, we've seen a plateau of cases. So that is a great indication that our efforts are working.
So when you say a plateau, are they declining yet?
No, so in some parts of the state they are. So for example, Summit County has seen a huge drop off, but overall statewide, we're just in a flattening. We haven't yet seen that decline.
So of late, we've heard that the state is quote unquote opening up again. How do you feel about that?
Yeah, my role is to provide the best subject matter expertise, scientific expertise to the governor and his team, and do that from a public health perspective. And that's exactly what I do. He then takes a lot of opinions from other experts because we know that this pandemic is not just affecting people's health. And so policy has to be well-rounded. So, he takes all this guidance and then forms the best policy. And, of course, the way he's chosen to go is to start slowly opening up society. So what that does for public health is it just means we have to be even more vigilant in terms of identifying cases and doing really good contact tracing so we can continue to contain the spread.
Who makes these decisions, and how is it come to the conclusion that it's a good idea to open things up again?
Yeah, so the legislative, in the special session, the legislature created a public health and economic commission to respond to COVID-19. So this is the commission that makes these sorts of recommendations to the governor, and then the governor ultimately makes the decision on where we're going as a state.
How do you handle it if you disagree with a decision as a healthcare expert? What do you do?
Yeah, I mean, there's been plenty of instances throughout my career, but definitely in this pandemic where I have differences of opinions. But I'm thankful for the ability to be able to express those opinions and have leaders hear them. And so that's what I do is I, provide that guidance. If I think it's endangering people's health, I push it even further. There's so much we don't know about this pandemic. So decisions are hard to make because we can't predict exactly how things are going to happen. But I state my opinion and sometimes do it with more passion than other times, depending on the topic.
So you have the economic concerns, you have the jobs concerns, you have the physical well-being of the state concerns. Yeah. Which of those is most important?
Gosh, I mean, that's $1 million question. So of course, I am of the mindset that this is a health crisis first, followed by an economic crisis. We've taken the approach in Utah to handle both at the same time because they're so interconnected, and hopefully that'll put us in a better position to recover both health and economic wise as after this. But our economy can't run if people are still scared to go and do anything, regardless of what our rules are. So my role is to make sure that we're protecting people's health as most as we can.
Should people be scared?
We are still in an at-risk situation. We're not going to go back to kind of quote unquote normal for a really long time. So I really urge people to be thoughtful about their exposures to other individuals. And if it's not necessary, to still maintain that social distancing, because the COVID-19 embers are still there, and we are at risk for other peaks if people don't adhere to the guidance that we've set forth.
It's a little confusing because it's sort of a dual message. Go ahead and open things up, but be careful. Can both be accomplished, especially as the case numbers continue to climb?
Yeah, and that's what we're aiming for with this tiered approach to opening up. So, we go from strict regulations and then open them up, but with a lot of modifications. For example, still have social distancing between families at restaurants. So it doesn't go from kind of closed to open. So this tiered approach will hopefully allow us to safely but slowly open up pieces of our economy.
You mentioned the testing. How is it completely prevalent now? Anybody who feels like they need to have a test, is it available to them, not only for the coronavirus or COVID, but also for antibody testing and those things? And are those tests all accurate?
Yeah, so the test we use to diagnose someone with active infection is called a PCR test, and that's what we have a lot of capacity in the state for. So anyone who has symptoms or has exposure to COVID-19 should and can get a test. And so that's what's available right now. And that test is highly accurate if you have a reason to be tested. What we don't know is for those people who have zero symptoms and zero exposure, what is that accuracy of the test? And studies are ongoing to determine if that's useful in those populations. The antibody test is a little different. That tells you if you have been exposed in the past, and our own lab, ARUP here, has developed a great test for that, and that is available through a physician order. So if an individual patient, if someone out there, thinks that they need an antibody test, they need to talk with their provider about getting that ordered.
What is the usefulness of having that done? Is it a peace of mind thing? Is it an immunity thing? Why should I be motivated to go do that? Is it so I can help other people if I have had it?
That's a tough question, because antibody testing tends to have a lot of false positives, meaning it'll show that you've been exposed to COVID, but when in fact you haven't. And you're right, what it tends to tell us, antibody testing in general, is if someone's immune. But right now we just don't know enough about COVID-19 to know if anybody builds immunity. There have been some reports of reinfection. And if there is immunity, we don't know how long it lasts. So lots of unknowns. But the purpose of it right now is really to understand exposure. So like you said, how prevalent is COVID-19 in Utah? Antibody testing will help us do that if we do it on a population level, and we have those activities in process right now.
Circling back for a minute, I'm going to put you on the spot.
Sure.
Okay. Tell me to take a fly and walk on a long walk on a short pier if you want. If it were up to you, would you be opening up our community right now?
I think we definitely have certain parts of our community that have experienced really good control of the pandemic. From a public health perspective, it would make me feel more comfortable if we were seeing that actual decline in cases. But again, these decisions are a balance, trying to find that sweet spot between health and economy, because ultimately economy affects people's health as well. So that's why, we do in public health have a little anticipation and anxiety about this, because it could set us up for a spike, but we're hopeful it doesn't.
When you talk about a spike, how big a spike are we talking about here, percentage-wise, to what we've already experienced?
There are a million models out there that will predict how many cases we're going to have. And I have to tell you, the only thing consistent about all of them is that they're all wrong. There's no way we're going to be able to predict the number of cases. So our goal is to, if we do start seeing an increase in cases, put the restrictions back, because we know they work and we don't want to overwhelm our healthcare systems. So at that first, evidence that we're seeing another spike in cases, public health will certainly be making recommendations to put those restrictions back in place.
Boy, that would be sort of a setback, wouldn't it?
Yeah, historically through other pandemics and infectious disease outbreaks, it's really tough to go backwards for society. Generally, when we start opening things up, there isn't a really good path to start closing them down again. However, Utah's unique. We tend to follow rules around here. And so, I'm confident that, our government and the people will do what's best for the health of Utahns.
When we talk about the testing and how widespread this virus has been, there have been some reports that it was here a long time before we thought it was here. Is that true? When were the first cases, both in our country and in our community?
Yeah, so for our community, I have to think that our prevalence is really low. And I think that because we have really low hospitalization rates and really low death rates, and both of those are good things. But if we had this kind of undercurrent of a lot of disease in our community, we would be seeing it in our hospitals. I hope I'm wrong. I hope that people have built up immunity and we've been able to kind of skirt this, but I'm anticipating that it's still really low. Nationally, right, this information has come out of California that there have been cases prior to when they thought initially they had started seeing cases. We're doing those similar kind of testing here in Utah to determine, like you said, if we did have cases before we had rampant testing, but we haven't found anything positive yet.
Why is this particular virus so deadly for some people and some people don't even know they have it?
Yeah, that is what's so scary about a novel virus, is because we don't know all the information, and it really is just heartbreaking. I wish we could predict exactly who was going to be hospitalized, need a ventilator, ultimately die. We do know there's people that are more at risk for that, and they follow the same risk profile for all diseases. Older adults, those with underlying medical conditions, will have worse outcomes, but that's not unique to COVID-19. I have personal experience of healthy adults being in the ICU and ultimately passing away from this. And so that's what makes it so scary and makes policy really, really tough.
I don't, check me if I'm wrong on this, but I read somewhere that half of America has some underlying condition of one kind or another. Because you have an underlying condition, does that mean that this is a death sentence for you, or does it just mean that you might be at a bit more risk? What's the dynamic there? Yeah,
so you're right. I mean, the conditions that put people seemingly at higher risk for severe disease from COVID-19 include things like obesity, hypertension, diabetes, lung disease. Those are very, very prevalent conditions in our society. So what that means is that if someone has one of those conditions and gets COVID-19, they're more likely to need hospitalization. And that's because their immune system is weakened by their underlying conditions. And so their own immune system can't fight off COVID as well as, say, a healthy young adult. So it's not a death sentence. It just means that those individuals really need to take social distancing seriously, and even be more strict on themselves than other parts of society.
But about 150 million Americans have some condition or another. That's a lot of people, you know?
It is. I mean, and we saw that in Italy, right? I mean, Italy was hit really hard, and a lot of scientists are saying it's because their population was so much older than the rest of the world, and that contributed to their increased death rate.
You talk about normalcy. I forgot what normal is.
Yeah.
I don't even know what normal is anymore. I'm sure that's more has been driven home to you more than anyone. But what is the path to normalcy? People talk about the vaccine and that being the real hope. Do you agree with that? And where are we along that timeline of finding a vaccine?
Yeah, absolutely. I mean, the key to beating COVID-19 is going to be herd immunity, where 60 to 80% of our population is immune to COVID-19. And people can become immune to a disease from getting it or from a vaccine. And for COVID, it's going to be getting a vaccine that's going to save us. That will allow us to protect those who are at highest risk for coming into contact with it, and then those other high risk populations who might get severe disease from it. There's been a lot of media around the timeline for vaccine. It's certainly on an expedited path, but there are necessary steps to creating a safe and effective vaccine that just can't be rushed and shouldn't be rushed, because once we get it out into the masses, we want to make sure it works and doesn't cause more harm than good. So realistically, we're probably a year away.
Still yet a year. So we're looking at May of 2021.
Exactly. So that's why we're all nervous about, potentially second wave, as they're calling it, in the fall, because we're not anticipating a vaccine to be available. It would be great if there is, but just realistically, we probably won't have one until the following season.
Along the lines of those with underlying conditions, I think I read 70 million Americans are 60 and older, something like that. I don't know the number. It's a lot of people.
Yeah.
How should those folks feel about this? Can they live their lives, or do they have to feel as though they need to stay inside their house and they're caged? They can't go out. What recommendation would you give for folks? Oh, I don't know anybody who's 60 and older, but let's say I have a friend who's 60 or older. What should that person do?
Yeah, so somewhere in between kind of the two extremes, right? If you're older than 65, you definitely need to take extra precautions and be very aware of who you're choosing to expose yourself to, right? Who you're choosing to be around. And that will help keep you safe. So we definitely want you to be able to stay inside, to stay distanced from people when possible. That doesn't mean be locked in a room, right? Go outside for walks. Find ways to do the things you enjoy doing, but just limiting your exposures to other people, and really staying socially distanced is going to be very important for the at-risk population, especially in the next month or so.
So I guess, is there a question I haven't asked you that Utahns need to know, or that you would stress that they keep in mind as we move forward on this thing?
Yeah, patience is going to be key. We are not going to jump to a zero risk life anytime soon. We have to be patient, and we have to realize that we're going to have to all make kind of these personal decisions about how much risk we are willing to take. So for someone who has an underlying medical condition, is over the age of 65, or even takes care of a high risk population, they're going to need to be more strict on social distancing than maybe other people. But it's up to us to figure out kind of what is that risk level we're willing to tolerate, because nobody has the right answers right now.
What message would you give to younger people who some of whom think this is no big deal because it doesn't have as much of an impact on them as it does on the groups that you and I have already talked about? What would you say to those younger people?
Our highest infection rate in Utah is the ages of 25 to 45. And we know that the younger than 25 can be carriers of the disease. They can get COVID-19 and just have a mild symptom like a cough or feeling achy and not think anything of it. So they might not recognize themselves as having COVID-19, but they can certainly spread it to others. So it is so important for all age groups to socially distance when possible, wear masks when they're out in public and social distancing is not possible, and make sure they're staying home whenever they feel ill, because this is really affecting all age groups, and we certainly don't want to be spreading it.
Do masks work?
So the face coverings that have been recommended, nationally and statewide help. Like if I'm wearing one, they would help it from me spreading my germs to other people. So it acts as just another barrier against spreading your own droplets to other people. So anything that can help prevent that spread of droplets is a good thing. And so we really are encouraging that in crowded situations, especially as we're opening up society more, right? That people wear masks to prevent that spread.
So let me get this straight. We have murder hornets. We have locusts in Africa eating the food there. We have this virus that's afflicting the entire globe. I don't want to get all biblical here, but when do the frogs show up? I mean, what's next?
I know.
And that's kind of a joke, but can we expect these kinds of pandemics to be on the rise moving forward?
Yeah, I mean, I think it's a sign of how connected our world is physically, right? I mean, travel is huge. International travel is very easy now. And I think that connectedness is great, but it also puts us at risk for spreading disease. So we'll just have to balance those two. I don't think we should shut down borders. I don't think we should stop travel. I think it's good for humanity to get to know other cultures and other people. But we're gonna have to continue to put resources into public health and science so that we can identify these diseases early and prevent pandemics.
Okay, two last questions. The first one is, if you are going to talk to government leaders, both locally and nationally, what would be your prudent advice to them moving forward? And then what would you tell the population as a whole, as far as whether you're optimistic or pessimistic or somewhere in between?
Sure. So for leadership in general, so nationally, state, internationally, I think reacting to squeaky wheels puts us in kind of a frenzy, and we really need to have a strategic approach that provides kind of a steady hand of guidance and advice to the public moving forward. Everyone is worried and panicked right now, and I think we all look to government and leaders to be that strategic voice that kind of ignores those squeaky wheels that come to everybody's attention. So less reaction and more steady hand, strategic response, I think, will be helpful for everybody, including solving the pandemic quicker. And for the population, because of my job, I probably have a more nervous approach to this because I've seen a lot. It is a serious disease, and when we don't have treatment or vaccine, we can't really predict how it's going to go. It is really scary, but we have to figure out how to still live our lives in a healthy and happy way. So again, I encourage everybody out there to figure out what that balance is between minimizing your risk and your risk to others while still enjoying life. And that's going to get us through this, because it's going to be another year, so we really need to figure out how to do this together.
How exacting has that mental toll been on the population?
It is definitely something that we are tracking and pouring resources into, especially when we started recommending that people isolate, right? Even that term is hard. And it's definitely hitting our senior population more, especially in the long-term care facilities where they're not able to have visitors. The other population that has really impacted our healthcare providers. They're out there on the front lines and dealing with what sometimes seems like a lose-lose situation. So we're working with our healthcare systems to really ensure that the resources are there for our frontline staff, because they're really the ones shouldering all the burden here.
I know the economy is important, business is important, jobs are important,
Yes.
all of that. But Angela, as you know, as a physician, lives aren't expendable. You know, you can't just throw people away so that the pocketbook gets lined a little better. Do you think that our leaders know that?
You know, I sure hope so, and that's advice we keep giving. And I think they're making policy around that principle, definitely. You know, even from an economic perspective, having a lot of deaths is only going to hurt the economy longer. And so making sure that we save as many lives as possible is good for both health and the economy. And our leaders are well aware of that and working to make sure that the policy follows that principle.
Well, make sure your voice is heard amongst those folks, because they need to hear it, man. They need to hear it. Dr. Dunn, thank you. We appreciate it. Thanks for taking the time, and good luck moving forward. And figure out that vaccine, will you?
Yeah, not a problem, Gordon. Thanks so much for your time.
Thanks. Thanks for listening. Thanks for viewing, everybody. Appreciate it.
Bye.